Chapter 24, Communication. As a nurse, we communicate with patients and families to develop meaningful relationships. Patient safety also requires effective communication among the members of the healthcare team as patients move from one caregiver to another or from setting to setting. Good communication skills help to reduce the risk of errors. These skills promote improved patient outcomes and increase patient satisfaction. Competent communication maintains effective relationships within the entire sphere of the professional nursing practice, and it meets legal, ethical, and clinical nursing standards of care. Caring relationships are formed by a nurse, and those that are affected by the nurse's practice are at the core of the nursing profession. All behavior communicates, and all communication influences behavior. The ability to take initiative in establishing and maintaining communication, to be authentic, which is oneself, and to respond appropriately to the other person is effective communication. Effective interpersonal communication also requires a sense of mutuality or a belief that the nurse-patient relationship is a partnership and that both are equal participants. Nurses need to embrace a non-judgmental, holistic view of people and understand the need for effective, supportive communication and human interaction. A nurse becomes more competent within the nursing process when they develop communication skills. As a nurse, we learn to integrate communication skills throughout the nursing process as we collaborate with our patients and other team members to achieve goals. Using communication skills to gather, analyze, and transmit information and accomplish the work of each step of the nursing process. Each step of the process depends on effective communication between the nurse, the patient, the family, and members of the healthcare team. Nurses will use self-awareness, motivation, empathy, and social skills to build therapeutic relationship with our patients. Think about these challenging communication situations as you work through the communication chapter. People who are silent, withdrawn, and have difficulty expressing feelings or needs. People who are sad and depressed. People who require assistance with visual or speech disabilities. People who are angry or confrontational and cannot listen to explanations. People who are uncooperative and resent being asked to help others. People who are talkative or lonely and want someone to be with them all the time. People who are demanding and expect others to meet their requests. People that are frightened, anxious, and have difficulty coping. People who are confused and disoriented. People who speak and or understand little English. People that are flirtatious or sexually inappropriate. Intrapersonal communication is a very powerful form of communication that an individual uses as a professional nurse. This level of communication is also called self-talk. People's thoughts and inner communications will strongly influence perceptions, feelings, behavior, and self-esteem. We should always be aware of the nature and context of our own thinking. Positive self-talk will provide a mental rehearsal for difficult tasks or situations that one may deal with more effectively and with increased confidence. Interpersonal communication is a one-on-one interaction between a nurse and another individual that most often occurs face-to-face. It is the most frequently used in nursing situations, and it is also foundational to the nursing practice. It can take place within a social context and includes all the symbols and cues used to give meaning and receive meaning. Because meaning resides in people and not in words, messages received are sometimes different from what is intended. Nurses work with people who have different opinions, experiences, values, and belief systems, making it important to validate meaning or mutually negotiate it between the participants. Small group communication is the interaction that occurs when a small group of people meet and usually are goal-directed, and it requires an understanding of group dynamics. When nurses work on committees with other nurses or other disciplines and participate in patient care conferences, they use small group communication process. Communication in this situation needs to be organized, complete, and concise. Public communication is the interaction with an audience. Nurses will speak in front of groups of healthcare consumers, prevent scholarly work at conferences, or lead classroom discussions with students. Public communication requires special adaptations in eye contact, gestures, voice inflection, and the use of media materials to communicate messages effectively. Electronic communication is the use of technology to create relationships with patients and the healthcare team. Secure messaging provides an opportunity for frequent and timely communication with a physician or another healthcare member through the patient portal. Match the levels of communication. Stop to get the answer. The answer is number 1B, 2A, 3D, 4E, and 5C. You are invited to attend the weekly unit patient conference care. The staff discusses patient care issues. This type of communication is public, intrapersonal, transpersonal, small group. The answer is D. Nurses or other disciplines participate in patient care conferences. They use a small group communication process. Communication in these situations must be organized, concise, and complete. Communication is an ongoing and continuously changing process. The model shows the situational context inputs, channels of communication, interpersonal context concepts, and factors affecting the sender and the receiver. In this model, each person in the communication interaction is both a speaker and a listener, and may be simultaneously sending and receiving messages. Both parties view the perceptions, attitudes, and potential reactions to a sent message. Communication becomes a continuous and interactive activity. The referent motivates one person to communicate with another. In a healthcare setting, sights, sounds, sensations, perceptions, and ideas are all examples of cues that may initiate the communication process. Knowing a stimulus or a reference that initiates communication will allow the nurse to develop and organize messages more efficiently. The sender is the person who encodes and delivers a message, and the receiver is the person who receives and decodes the message. The sender puts the message into verbal and nonverbal symbols that the receiver can understand. The sender's message acts as a referent for the receiver. The message is the content of communication that contains both verbal and nonverbal expressions of thoughts and feelings. Effective messages are clear, direct, and understandable. Individuals with communication barriers may need assistance via devices like hearing aids, interpreters, or pictures to ensure that messages sent and received are understandable. Personal perceptions can also distort the receiver's interpretation of a message. Individuals use communication channels to send and receive messages through visual, auditory, and tactile senses. Facial expressions send visual messages. Spoken words travel through auditory channels, and touch uses tactile channels. Feedback is the message a sender receives from the receiver. This indicates whether the receiver understood the meaning of the sender's message. Feedback occurs continuously between a sender and receiver. A sender seeks verbal and nonverbal feedback to evaluate the receiver's response and effectiveness of a communicated message. Interpersonal variables are factors within the sender and the receiver that may influence communication. Perception provides a unique personal view of reality formed by an individual's culture, expectations, and experiences. Each person senses, interprets, and understands events differently. The environment, this is the setting for sender-receiver interaction. An effective communication setting provides participants with physical and emotional comfort and safety. Noise, temperature extremes, distractions, and a lack of privacy or space may create confusion, tension, and discomfort. Match the elements of communication. The answer is number 1, D, number 2, A, 3, G, 4, E, 5, C. 6, F, 7, B. Verbal communication uses spoken or written words. Verbal language is a code that conveys specific meaning through a combination of words. Communication is unsuccessful if senders and receivers cannot translate one another's words and phrases. When you care for a patient who speaks another language, a professional interpreter is needed. Medical terminology sounds like a foreign language to patients that are unfamiliar with the healthcare setting. As a nurse, we limit the use of medical words to conversations with other members of the healthcare team to improve communication. Some words may have several meanings. Individuals that use a common language share the denotative meaning. Baseball has the same meaning for everyone who speaks English, but code denotes cardiac arrest to healthcare providers. The connotative meaning is the shade or interpretation of the meaning of a word that is influenced by the thought, feelings, or ideas that people have about the word. Healthcare providers tell a family that a family member is in serious condition, and the family believe that death is near. But to nurses, serious may simply describe the nature of the illness. Conversation is more successful at an appropriate speed or pace. Speak moderately, slowly, and enunciate clearly. Talking rapidly, using awkward pauses, or speaking excessively slowly and deliberately conveys an unintended message. Tone of voice dramatically affects the meaning of the message. Depending on the intonation, even a simple question or statement expresses enthusiasm, anger, concern, or indifference. Be aware of the voice tone to avoid sending unintended messages. Effective communication is simple, brief, and direct. For some populations, like the elderly, fewer words will result in less confusion. Speak slowly, enunciate clearly, and use brief examples to make explanations easier to understand. The repeating of important parts of a message will also clarify communication. Timing is critical in communication. Even though a message is clear, poor timing will prevent it from being effective. The best time for interaction is when a patient expresses an interest in communicating. If messages are relevant or important to the situation, they are more effective. Nonverbal communication includes the five senses and everything that does not involve spoken or written word. Nonverbal aspects of communication, like voice tone, eye contact, and body positioning, is as important as the verbal message. Nonverbal communication is unconsciously motivated and more accurately indicates a person's intended meaning than spoken words. When there is incongruity between verbal and nonverbal communication, the receiver usually hears the nonverbal message as the true message. There are zones of personal space. The intimate distance is 0 to 18 inches. This would be like performing a physical assessment or performing activities of daily living with your patient. The personal distance is 18 to 40 inches. This is like sitting at a patient's bedside, teaching an individual patient. A social distance is 4 to 12 feet. This would be giving directions to visitors in the hallway, giving a verbal report to a group of nurses. Public distance is 12 feet or more. This would be speaking at a community forum or lecturing to a class of students. There are also special zones of touch. In the social zone, there is no permission needed. This would be the hands, arms, shoulders, and back. The consent zone requires permission. This is the mouth, wrists, and feet. The vulnerable zone, this requires special care. This is the face, the neck, and the front of the body. The intimate zone, this requires permission as well as great sensitivity. This is for the genitalia and rectum areas. Metacommunication is a broad term that refers to all factors that influence communication. The awareness of influencing factors helps individuals better understand what is communicated. Caring relationships are the foundation of clinical nursing practice. In this type of relationship, the nurse assumes the role of a professional who cares about each patient and their unique health needs, human responses, and patterns of living. therapeutic relationships promote a psychological climate that promotes positive growth and change. The goals of a therapeutic relationship focus on a patient achieving optimal personal growth related to their personal identity, ability to form relationships, and the ability to satisfy needs and achieve personal goals. There are phases of a helping relationship. The first is the pre-interaction phase. This is before meeting a patient. Here, the nurse will review available data, look at the medical nursing history, talk to other medical professionals that may have information about the patient. They will pick a setting and a location to foster comfortable and a private interaction. And they will plan plenty of time for the initial interaction. The orientation phase. This is when the nurse and the patient meet and get to know each other. During this phase, the tone for the relationship will be set by adopting a warm, empathetic, caring manner. The recognition that the initial relationship is often superficial, uncertain, and tentative is understood. The nurse will expect the patient to test their confidence and commitment. The nurse will begin to make inferences and form judgments about patients' messages and behaviors. They will assess the patient's health status and prioritize the patient's problems, along with identifying their goals. During this phase, they will clarify the patient's roles and the nursing roles. They will form verbal contracts with the patient that specify which each individual will do. The nurse will let the patient know when to expect the relationship to be terminated. The working phase is when the nurse and the patient work together to solve problems and accomplish goals. During this phase, encouragement and help from the nurse for the patient to express their feelings about their health. There will be encouragement and help for the patient with self-exploration. Information will be provided that is necessary to understand and change behavior. Encouragement and assistance will be provided to help the patient set goals. Action will be taken to meet the goals that are set with the patient. Therapeutic communication skills will be used to facilitate successful interactions. Self-disclosure and confrontation will be used appropriately. The last phase is the termination phase. This is during the end of the relationship. The nurse needs to remind the patient that termination is near. The nurse will evaluate the goal achievement with the patient. The nurse will reminisce about the relationship with the patient. During this time, the nurse will separate from the patient by relinquishing responsibility for their care. After a smooth transition for the patient as needed, it will be achieved for the patient. Motivational interviewing is a technique that encourages patients to share their thoughts, beliefs, fears, and concerns with the aim of changing their behavior. Motivational interviewing provides a way of working with patients who may not seem ready to make behavioral changes that are considered necessary by the healthcare provider. The nurse can use it to evoke change talk, which links to improve patient outcomes. The same principles that guide a one-on-one helping relationship also applies when the patient is a family unit. Although communication within families does require additional understanding of the complexities of the family dynamics needs, and relationships. The nurse's communication with other members of the health team affects patient safety and the work environment. Patient health outcomes are optimized when healthcare members communicate well. Problems will occur when communication is ineffective. SAKAYA acronym is sufficiency, accuracy, clarity, contextualization, and interpersonal adaptation. SBAR, these begins with identifying the step with an introduction. Then we provide a description of their location and the nurse's role caring for the patient. The S is situation, then background, then assessment, then the read back, and another R is added for our recommendation. Lateral violence or workplace bullying between colleagues sometimes occurs and includes behaviors such as withholding information, backbiting, making snide comments, and nonverbal expressions of disapproval, like raising eyebrows or making faces. Lateral violence adversely affects the work environment, leading to job dissatisfaction, a decreased sense of value, poor teamwork, poor retention of qualified nurses, and nurses leaving the profession. Lateral violence interferes with effective healthcare team communication and jeopardizes patient safety. There must be zero tolerance of lateral violence. Developing skills in conflict management and assertive communication will assist to stop the spread of lateral violence within the nursing workplace. As a nurse, we learn to establish relationships within one's community to be an effective change agent. We provide clear and accurate information to members of the public. This is the best way to prevent errors, reduce resistance, and promote change. Reading through the case study, pause and ask yourself, what are some important communication areas for Suzanne and Roberto? Helping relationships serve as the foundation of clinical nursing practice. Contracts for a therapeutic helping relationship are formed during the orientation stage, working stage, termination stage, pre-interaction stage. The answer is A. During the stage when the patient and the nurse get to know each other and form contracts with the patient that will specify who will do what is the orientation stage. Common courtesy is part of professional communication. To practice courtesy, say hello and goodbye to patients. Knock on doors before entering. The nurse should state their purpose, address individuals by the name they prefer to be called, and use the words please and thank you to patients and team members. The nurse should introduce themselves and state their title. Always introducing oneself is vital. Failure to provide one's name and status or to acknowledge a patient creates uncertainty about an interaction and may convey an impersonal lack of commitment or caring. Making eye contact and smiling are ways to recognize others. Addressing individuals by the name they wish to be called conveys respect for their human dignity and uniqueness. We should always avoid terms of endearment like honey, dear, sweetheart, or grandma. Trust is relying on someone without doubt or question. Being trustworthy means helping others without hesitation. To foster trust, communicate warmth and demonstrate consistency, reliability, honesty, competence, and respect. Autonomy is being self-directed and independent in accomplishing goals and advocating for others. Professional nurses make choices and accept responsibility for the outcomes of their actions. Assertiveness allows the nurse to express feelings and ideas without judging or hurting others. Assertive behavior includes intermittent eye contact, nonverbal communication that reflects interest, honesty, and active listening, spontaneous verbal responses with a confident voice, and culturally sensitive use of touch and space. An assertive nurse communicates self-assurance, communicates feelings, takes responsibility for their choices, and is respectful of others' feelings, ideas, and choices. While considering this case study, what questions might you pose to help the patient reflect and allow you as a nurse to assess the needs of the patient? Nurses apply the nursing process and use a critical thinking approach in the care of their patients. The nursing process provides a clinical decision-making approach for the nurse to develop and implement an individualized plan of care. It guides care for patients who need special assistance with communication. The use of therapeutic communication techniques is a good intervention in any interpersonal nursing situation. It is especially important to assess the psychophysiologic factors that influence communication. Many altered health states and human responses will limit communication. Individuals with hearing or visual impairments often have difficulty receiving messages. Specific aspects of a patient's growth and development will also influence the nurse-patient interaction. The nurse should adapt communication techniques to the special needs of infants and children and their parents. One's culture influences thinking, feeling, behaving, and communicating. The nurse needs to be aware of the typical patterns of interaction that characterize various ethnic groups, but do not allow the information to bias the nurse's response. Knowing each patient individually is vital. People from other countries do not always speak or understand English. Those who speak English as a second language often have trouble with self-expression or language comprehension. To practice cultural sensitivity in communication, understand that people of different ethnic origins use different degrees of eye contact, personal space, gestures, loud voice, pace of speech, touch, silence, and meaning of language. Gender influences how one thinks, acts, feels, and communicates. Men tend to use less verbal communication, but are more likely to initiate communication and address issues more directly, and also are more likely to talk about issues. Women often disclose more personal information and use more active listening, answering with responses that encourage the other person to continue the conversation. It is important that the nurse recognizes a patient's gender communication pattern. What is Suzanne demonstrating in the case study? Her understanding of the importance of the extended family in the Puerto Rican culture helps her appreciate the importance of the trip to New York. Expressing an understanding of the importance of the trip, even though Roberto is in poor health and it will be a difficult trip, demonstrates cultural sensitivity. Many individuals experience difficulty with some aspect of communication. Patients sometimes lack skills in attending, listening, responding, and self-expression due to the result of illness, treatment effects, or cultural or language barriers. The primary nursing diagnostic label used to describe a patient with limited or no ability to communicate verbally is impaired verbal communication. Motivation is a factor in improving communication, and patients often require encouragement to try different approaches that involve significant change. It is especially important to involve the patient and the family in decisions about the plan of care to determine whether the suggested methods are acceptable. The nurse should consider ways to meet basic comfort and safety needs before introducing new communication methods and techniques. Once the nurse identifies a diagnosis, a goal should be selected that is relevant and achievable for that patient, like being able to express needs or achieving an understanding of physical condition. The next step is to select expected outcomes that are very specific and measurable. The outcomes identify ways to determine whether a broader goal is met. In the case study, Suzanne identifies 2 outcomes from her conversation with Roberto. What are the outcomes that Suzanne has identified? In carrying out any plan of care, use communication techniques that are appropriate for the patient's individual needs. Before learning how to adapt communication methods to help patients with serious communication impairments, it is necessary to learn the communication techniques that serve as the foundation for professional communication. Active listening means being attentive to what the patient is both saying verbally and non-verbally. It facilitates patient communication. The surety model, S stands for sit. Sit at an angle facing the patient. Sitting at a slight angle to the patient creates a non-confrontational seating arrangement that is conducive to communication. This posture conveys the message that the nurse is there to listen and the nurse is interested in what the patient is saying. U, uncross legs and arms. This position suggests that the nurse is open to what the patient has to say. A closed position, like crossing the arms, conveys a defensive attitude and possibly will provoke a similar response within the patient. R, relax. It is important to communicate a sense of being relaxed and comfortable with the patient. Restlessness communicates a lack of interest and a feeling of discomfort to the patient. E, eye contact. Establish and maintain intermittent eye contact to convey your involvement and willingness to listen to what the patient is saying. The absence of eye contact or shifting the eyes gives the message that you are not interested in what the patient is saying. T is for touch. Use touch that is respectful to communicate empathy and understanding to the patient. Ensure that the use of touch is therapeutic and acceptable to the patient. Why? Your intuition. As a nurse, we need to trust our intuition as we grow in confidence to individualize, adapt, and apply communication techniques within our interpersonal encounters with our patients. Nurses make observations by commenting on how the other person looks, sounds, or acts. Stating observations often helps a patient communicate without the need for extensive questioning, focusing, or clarification. This technique can help start a conversation with the patient who is quiet or withdrawn. Empathy is the ability to understand and accept another person's reality, accurately perceive feelings, and communicate the understanding to the other. This is a therapeutic communication technique that enables the nurse to understand a patient's situation, feelings, and concern. Nurses recognize that hope is essential for healing and learn to communicate a sense of possibility to others. Appropriate encouragement and positive feedback are important in fostering hope and self-confidence and for helping people achieve their potential and reach their goals. The nurse gives hope by commenting on the positive aspect of the other person's behavior, performance, or response. Humor is an important but often underused resource in nursing interventions. It is a coping strategy that can reduce anxiety and promote positive feelings. Humor is a perception and attitude in which a person can experience joy even when facing difficult times. It provides emotional support to patients and professional colleagues and humanizes the illness experience. It also enhances teamwork and relieves tension. Emotions are subjective feelings that result from one's thoughts and perceptions. Feelings are not right, wrong, good, or bad, although they are pleasant or unpleasant. If individuals do not express feelings, stress and illness may worsen. The nurse helps patients express emotions by making observations, acknowledging feelings, encouraging communication, giving permission to express negative feelings, and modeling healthy emotional self-expression. The art of touch is one of the most potent and personal forms of communication. It expresses concern or caring to establish a feeling of connection and promote healing. Touch conveys many messages like affection, emotional support, encouragement, tenderness, and personal attention. Silence prompts some individuals to talk. It allows a patient to think and gain insight. Overall, the nurse should allow a patient to break the silence, particularly when they have initiated it. Providing relevant information tells other individuals what they need or want to know so that they are able to make decisions, experience less anxiety, and feel safe and secure. It is also an integral aspect of health teaching. To check whether the nurse understands a message accurately, the nurse should restate an unclear or ambiguous message to clarify the sender's meaning. In addition, ask the other person to rephrase it, explain further, or give an example of what the individual means. Without clarification, the nurse may make invalid assumptions and may miss valuable information. Focusing involves centering a conversation on key elements or concepts of a message. If conversation is vague or rambling, or patients begin to repeat themselves, focusing is a useful technique. Do not use focusing if it interrupts patients while they are discussing important issues. Rather, use focusing to guide the direction of the conversation. Paraphrasing is restating another's message more briefly using the nurse's own words. Through paraphrasing, the nurse sends feedback that lets a patient know that they are actively involved in the search for understanding. Accurate paraphrasing does require practice. Validation is a technique that nurses use to recognize and acknowledge a patient's thoughts, feelings, and needs. Patients and families know they are being heard and taken seriously when the nurse addresses their issues. This type of statement enables the nurse to convey empathy and interest in the patient's thoughts, feelings, and perceptions. The nurse should ask relevant questions to seek information needed for decision making. The nurse should only ask one question at a time and fully explore one topic before moving to another topic. Summarizing is a concise review of key aspects of an interaction. It brings a sense of satisfaction and closure to an individual conversation, and it is especially helpful during the termination phase of the nurse-patient relationship. By reviewing a conversation, participants will focus on key issues and add relevant information as necessary. Self-disclosures are subjectively true personal experiences about the self that are intentionally revealed to another person. This is not therapy for the nurse. However, it shows a patient that the nurse understands their experiences and that they are not unique. The nurse chooses to share experiences or feelings that are like those of the patient and emphasize both the similarities and the differences. This kind of self-disclosure is indicative of the closeness of the nurse-patient relationship, and it indicates respect for the patient. When the nurse confronts someone in a therapeutic manner, the nurse helps the other person become more aware of the inconsistencies in their feelings, attitudes, beliefs, and behaviors. This technique will improve the patient's self-awareness and help them recognize growth and deal with vital and important issues. The use of confrontation should only happen after the nurse has established their trusting relationship. Some methods of communication techniques will hinder or damage the professional relationship. These specific techniques are referred to as non-therapeutic or blocking, and they often cause others to activate defense to avoid being hurt or negatively affected. Asking personal questions that are not relevant to a situation simply to satisfy the nurse's curiosity is inappropriate professional communication. These forms of questions are nosy, invasive, and unnecessary. When a nurse provides a personal opinion, this will take away decision-making from the patient. This will inhibit spontaneity, stall problem-solving, and create doubt. Personal opinions differ from professional advice. Changing the subject when the patient is trying to communicate their story is rude and shows a lack of empathy. This blocks further communication and the sender then withholds important messages or fails to openly express their feelings. Stereotypes are generalized beliefs held about people. Making stereotyped remarks about others reflects poor nursing judgment and threatens nurse-patient or team relationships. When the patient is reaching for understanding, false reassurance discourages open communication. Offering reassurance not supported by facts does more harm than good. Although the nurse is trying to be kind, this has the secondary effect of helping the nurse avoid the patient's distress. And this tends to block conversation and discourage further expression of the patient's feelings. Sympathy is concern, sorrow, or pity felt for another person. A nurse will often take on a patient's problems as if they were their own. Sympathy is a subjective look at another individual's world that prevents a clear perspective of the issue that is confronting the patient. If the nurse over-identifies with the patient, objectivity is lost, and the nurse is then unable to help the patient work through the situation. Asking why questions causes resentment, insecurity, and mistrust. The nurse should not impose their own attitudes, beliefs, values, or moral standards on patients while in the professional helping role. Becoming defensive in the face of criticism implies that the patient has no right to their opinion. The sender's concerns are ignored when the nurse focuses on the need for self-defense, defense of the healthcare team, or defense of others. Passive responses serve to avoid conflict or sidestep issues. These reflect feelings of sadness, depression, anxiety, powerlessness, and hopelessness. Aggressive responses provoke confrontation at the other individual's expense. These reflect feelings of anger, frustration, resentment, and stress. Challenging or arguing against perceptions for the patient denies that they are real and valid. With the aging population, more individuals have difficulty in communicating. Hearing loss increases with age. Vision loss affects communication and presents a challenge for many individuals, especially those over age 65. Vision loss is among the top 10 disabilities in the United States. While admitting a patient, during the initial interview, a family member tells you, "My mom really means that she does not understand her medical diagnosis." The communication form used by the family member is focusing, clarifying, summarizing, paraphrasing. The answer is B. When someone like a family member of a patient tries explaining what they believe the patient means, the person is clarifying to ensure that the nurse has understanding. The nurse needs to evaluate the effectiveness of their own communication by videotaping practice sessions with peers or by making process recordings, which are written recordings of verbal and nonverbal interactions with patients. Process recording analysis reveals to the nurse how to improve personal communication techniques to make them more effective. unexpected outcomes for the patient's plan of care are not met, or if progress is unsatisfactory, the nurse will determine which factors influence the outcomes and modify the plan of care. If the nurse's evaluation data indicates that a patient perceives difficulty in communication, the nurse will explore contributing factors so that the factors may be addressed. Evaluation of the communication process helps nurses gain confidence and competence in interpersonal skills. Becoming an effective communicator greatly increases the nurse's professional satisfaction and success.